We are the Necrotizing Fasciitis Foundation, also referred to as NFF. Our mission is to advocate and to spread awareness about necrotizing fasciitis, a rapidly spreading bacterial infection that can destroy skin, fat, and tissue covering muscles, often referred to as the flesh-eating disease. To contribute, participate, or for more information, please visit our website at necfasc.org.
I would like to thank I would like to welcome our guest on this very special episode of The Steep, Dr. Eileen Bulger. Dr. Bulger is Chief of Trauma at Harborview Medical Center, Professor of Surgery at University of Washington, was named President-elect of the American Association for Surgery of Trauma in 2021, and she's our medical contributor at the Necrotizing Fasciitis Foundation. I will now add Dr. Bulger to the conversation. Hello, Dr. Bulger, and welcome.
Good morning. How are you?
I am fine. How are you doing?
Good. Good to see you.
Well, I guess we'll get right to it. Can you give us a little bit of your background?
Sure. As you mentioned, I'm a general surgeon. I work at the University of Washington's Harborview Medical Center, which is the regional level 1 trauma center for not only the state of Washington, but we receive patients from as far away as Alaska and Montana. And we're also the burn center. And so as a result of being a center that's used to taking care of critically ill patients, we have become really a major referral center for patients with necrotizing soft tissue infections from that entire region. So unfortunately, I've had a lot of experience with this disease, and I'm very passionate about looking for creative solutions for it. And so we've done a lot of research in this area and really trying to come up with strategies to reduce the not only deaths, but also the long-term consequences of the disease.
Right. Well, speaking of NF, some questions that we've collected over the last few weeks from our members of the group. One of them is, can NF be prevented?
Yeah, so it's a tough disease because there's lots of different causes for it. Some of the common causes that that potentially could be prevented are deep wounds that people get. Stepping on a nail or any kind of deep puncture wound can introduce bacteria deep into the tissues. And so obviously trying to avoid those things in the workplace, but also if something like that happens, seeking medical attention early so that you can get appropriate treatment is important. There are other types of necrotizing soft tissue infection that are caused by skin infections that start out as a more superficial infection, but then can spread more deeply if not treated. So again, if you get an infection in the skin, seeking medical attention early is really important. Get on antibiotics early. Sometimes if you have a fluid collection that needs to be drained, it can be drained earlier, and that potentially could prevent the progression. But in some cases, we don't even know why patients get it, and then there's nothing they could have done to prevent it.
So if there's no wound site or surgery site, how does NF get in to start?
That's a really good question. Yeah, and there's up to 20% of necrotizing soft tissue infections are in that category where there's not an obvious source many times. And we're not entirely sure. We think that the bacteria gets seeded through the bloodstream. So you could have something like a strep throat, or which seems like a minor illness, but maybe you have an injury to a muscle somewhere, and in the bloodstream, the bacteria gets to that area, and then you can develop a necrotizing infection that way. So it's a really tricky disease.
Oh, wow, I didn't know that, and I thought I knew a lot about it. Are people who had NF, are they immunocompromised, or are they after recovery?
Yeah. So being immunocompromised increases your risk of developing it in the first place. So many people who are on chemotherapy for cancer, who are immunocompromised or have a medical problem that makes them immunocompromised, and diabetes also increases your risk significantly because that also affects your immune system. So just being immunocompromised increases your risk of getting the disease. Whether there's long-term consequences to your immune system from the disease, we don't really know. We don't think that it makes you immunocompromised afterwards, but we haven't really studied the long-term effects as well as we need to.
Once someone's had it, are they greater at risk of getting it a second time?
So certainly, if they've gotten it once, again, depending upon what their other medical issues are that put them at risk to get it, they could, if those continue, they could be at risk again. But again, we haven't had a chance to really study the long-term consequences, and so we don't know exactly what the lifetime risk is.
What types of things can someone eat to promote healing, and what should they avoid eating?
Yeah, so there's nothing specific. In general, especially if you have a big wound from your surgery, a well-balanced, well-rounded, healthy diet with a lot of protein is important, because protein does really help wound healing. But there's no specific diet that you need to avoid.
Here's a big question. In your opinion, do you think NF survivors should have a psychiatric evaluation before going home? For example, PTSD and other conditions or emotional situations?
That's a really important question. And I think we are thinking more and more about patients who suffer from critical illness and what the long-term consequences of that are on their mental health. People can get PTSD just from being in the intensive care unit. It's a very unusual environment, and you feel like there's a loss of control there. So I think that as a medical community, we are paying more attention to that, and we are looking at ways to screen patients in the hospital, but also to make sure that they have the resources, when they're discharged, because many of these things may not show up until, after you've gotten home from the hospital and you're realizing, what the challenges are of being out of the hospital, and then it can hit you then. So I think it's important to screen in the hospital for these things, but also to make sure that the follow-up after the hospital provides that support network for patients.
Yes, for sure. I know from my experience with the support group I've got, I would say at least 75% are suffering through some sort of PTSD. What is the survival rate of NF right now?
Yeah, so the good news is that's been improving over time, in part, I think, because we're raising awareness and we're paying attention to it and trying to get it diagnosed early, because delays in diagnosis can really increase the mortality. So if you look at the most recent studies, the mortality ranges anywhere, or death rate ranges anywhere from 10 to 15%. So that's a survival rate of 85 to 90%.
It's better than it was when I heard about it about 16 years ago.
Yes, it used to be as high as 40% death rate from this disease. So it has improved over time, but there's still obviously a lot of people living with the consequences of it.
For sure. Are there any scientifically proven treatments to beat NF, or is it different with every patient, like trial and error?
Yeah. So I think what we know is that catching it early is important, and treating it aggressively is important. So that includes really broad spectrum antibiotics as early as we can give them to the patient, and then prompt surgical management. So this type of disease requires that you go to the operating room and remove that dead tissue, because otherwise it will continue to spread. And so being in a place where you can get the antibiotics quickly, get to the operating room quickly, those are the sort of cornerstones of the management. We've been studying other things, we've been studying other approaches, but right now those two things are the most important.
Right. How much does the hyperbaric treatment increase survival rates?
That data on that is really mixed. I don't think we have definitive data to say that it improves survival in this disease. There is some role for it in patients with really chronic wounds that are infected, but in the emergency setting, we don't know that it's valuable, and it could be risky because you're taking a patient who needs intensive care and you're putting them in a chamber with very limited care, and that could be risky. So in general, we don't use it in the acute setting, but it is something that sometimes can be used in a more chronic setting.
What can someone do about scar tearing and skin graft tearing?
Yeah, that can be really, really tough to manage. I think, obviously working closely with your surgeon, usually the plastic surgeon that's involved in the reconstruction, is important. early on, once you're cleared for physical therapy, to sort of range and stretch and do those exercises can be important to minimize the risk of more heaped up scarring. But everybody's scars differently, right? So some people have more trouble with their scar than others. And I think, working with your plastic surgeon is probably the key for that.
Well, speaking of the skin graft, does the healed skin graft or harvest site need any special care?
So in the early phase, there's usually a special dressing that's on there to kind of protect it. And then over time, as it heals, it's really being cautious of that area so there's not any damage to it or re-injury while the skin is healing because it's fragile, so you have to protect it and be cautious of it. But over the long term, again, usually things heal well and doesn't need any special long-term care.
Is there any special aftercare someone should do for their wound or their scar area?
Well, it's important, it's interesting. Wound healing is interesting. It takes about a year for your scars to remodel to what they're finally going to be. It's just a very slow remodeling process. So you have to be patient with it. I think that one of the things that we recommend is avoiding, excess sun exposure, not getting a sunburn, kind of over that area. Again, damage to that fragile skin is something you really want to avoid. Some data around vitamin E creams and things like that to sort of help the healing of the scar. It's not strong data, but it probably doesn't hurt. But I think the real key is protecting that skin and avoiding it re-injury to it.
Foreigner's gangrene is a type of NF in the perineal area. Are there any special treatment, skin or scars from foreigner's gangrene?
Yeah.
To the skin or scars, I'm sorry.
Sure, yeah. I mean, it's a similar process to pretty much anywhere else on the body. It's just obviously a difficult location for patients to take care of. I think the same principles apply, though, is really trying to avoid re-injury to the area, protecting those as best you can, and then giving it time to heal.
What can be done about long-term issues like pain and post-sepsis syndrome?
Yeah. So post-sepsis syndrome is another thing that we're learning about over time. What are the long-term consequences of people that have had very severe infections? And what does that mean? I think we don't know yet. We're still trying to understand the scope of it, but we're not sure how to prevent it. But I think we're looking at, how we treat patients in the ICU and whether there's things that we can modify there that will reduce some of those longer-term risks. It's an area for active study.
What are the long-term after effects that you're seeing from NF? I know there's not a lot of studies done on that.
There have been some surveys, looking at obviously, the it varies a little bit depending upon the extent of the surgery you've had and what part of the body is infected, was affected by the surgery. But certainly it impacts people's ability to return to work. There can be pain issues, as you alluded to, that can be a real problem long term. And we're looking at different ways to approach that. People can become opioid dependent, which we obviously want to avoid because of the risks associated with that. And in general, the quality of life indicators that we measure are definitely impacted when patients go home, and it can take a long time to recover from that.
There's been some studies that say NF survivors are at risk of having a shorter lifespan. Is that true?
Again, I think it's something we don't totally know. It's hard to sort out. In some patients who have necrotizing fasciitis also have a lot of other medical problems, right? Or they're immunosuppressed from other problems like cancer or something. That it's hard to sort out if the life expectancy is based on those other medical problems that put them at risk for NF, or if it's the NF also. So I think we need more data to understand that, and obviously we want to minimize that impact.
Speaking of that, can any new side effects appear like 20 years after your initial diagnosis, similar to like a polio survivor?
Yeah, we don't think that's likely. Obviously, there's the long-term effects of the wound, and if there's problems with the wound, or if there's subsequent issues with it, that can be an issue. But we don't expect any long-term things to pop up, that impact the rest of your body or your immune response. But again, studies are limited.
Right. So we've got I haven't talked to you about this yet. We've got Dr. Zazik coming.
Zazik.
Zazik, that's right. Sorry, my pronunciation was. He's going to be on our show next week. I think he's a fellow doctor of yours there where you are.
Yes, he's a specialist that I work with very closely.
He's going to be talking a lot about the PTSD. That's why I didn't really go into it a lot with you today. Plus, it's more of his specialty. You're more of the hands-on, trying to help everybody. Are there anything that you could suggest to someone once they get home? What are the best practices?
Yeah.
Sorry to put you on the spot like that.
Yeah, no, I think it depends a lot, again, on the situation. I think making sure that you have really clear instructions on your wound care from the hospital, and you understand what needs to happen there. There's different types of care that can be provided to wounds afterwards. Sometimes there's a vacuum dressing that's put on that you need to come in and have changed. Sometimes it's dressing changes you need to do yourself or your family needs to do. So I think understanding and having a good plan for your wound care is important. Making sure that you come back for all of your doctor's appointments, because we want to keep an eye on the progression of things and making sure that there's not any complications. I think those are kind of the key things, after you get home. And then obviously giving yourself some grace. You've just been through a really tough experience, and hopefully you have good family support around you, some time for your work to give yourself a chance to recover.
Right. This, if you're able to answer this, someone just submitted it. It said their 3-year post-op healed, but keep getting cellulitis. Have had it 33 times. I'm on a daily Bactrim now. Will I have to take antibiotics the rest of my life?
Yeah, it's a tough question, not knowing the exact case, but it sounds like there's something that's putting you at risk for these recurrent infections. And so in some cases, a long-term suppression of antibiotics is needed.
Here is one about which I personally have an issue with. They said their beautiful teeth are falling apart, turn dark white, not really yellow, but crack and fall apart now. Now, an issue prior to, is that a normal, after NF, is that a normal thing that you're seeing from any of your patients? I know we don't have long-term studies, but just based on what you've seen.
Yeah, I have not heard reports of that. There are patients who develop necrotizing infections as a result of dental infections, and that can spread into the neck. So if you have poor teeth to begin with, that can be a risk factor. But I have not heard of long-term impact on the teeth. So it would be something we would need to investigate.
I know when mine after my NF, when my teeth started, I went to a dentist and they didn't know about necrotizing fasciitis, but that put them on the track to start looking into that. Someone said, paranoid about being clean. Do we need to use antibacterial everything, or can we use regular soap?
Yeah, so regular soap is fine. I think it's natural, again, to feel like, gosh, is there anything I can do to prevent this, right? And so, but regular soap is just fine. And if you develop a skin infection, just seek treatment early. That's really the key. And the soap isn't going to reduce that risk.
Is it a natural fear of water after NF that you know of going back into water?
I don't know of that, but there are types of NF that are caused by waterborne organisms. They're less common in the US because they tend to be in more tropical, warm climates. But I can imagine if you had one of those types of infections that you got from warm water, that you would be pretty nervous about that, and that could be part of your PTSD even. So I would think in that setting that might be a real issue for people.
think that's all the questions. I don't see any more. Appreciate you being here. Is there any information that you think we should know about
No, I just
going
look.
forward?
I appreciate the opportunity to talk with you. I think, as you said, this is a relatively rare disease, and so it's under-recognized, but it has real major consequences for patients. And so we are working actively to try to find solutions, and appreciate the Necrotizing Fasciitis Foundation for the work that you're doing to raise awareness, because I think, we need to hear the voice of patients who have suffered from this disease so that people will invest in solutions. So I just want to thank you for the opportunity to be here, and always happy to talk with you.
I would like to thank Dr. Bulger for being here today. If you have any questions for Dr. Bulger, just submit them to us here at the show at info@thesteep.org. Dr. Bulger, it was great seeing you again, and thank you so much for being here.
You too. You too. Take care.
You have a great day.
You too.
I'd like to remind you all of the virtual virtual walkathon coming up on May 28th. There will be prizes for who raises the most money and who shows the most spirit dressing up in awareness garb to spread awareness. Thank you for tuning in today. I hope to see you on the next episode of The Steep. Everyone, please remember to be kind and to smile. Have a great day.